Up next, we have Glico eHealth. Nathaniel Kofi will be coming to do the presentation for us. Again, you have 10 minutes, Nathaniel.
So thank you so much, Kwame, for the opportunity, and thanks so much, NCA, for granting us this opportunity. I will stand on the existing protocols started by DG, since I cannot identify and mention all the big names here. But thank you so much for the opportunity. As you rightly said, my name is Nathaniel Kwame Kofi, Head Sales for Glico Healthcare, and I'm here with my CMO, Madame Benisa Megashi, who is seated at the back. At Glico Healthcare, we have quite a lot of innovative ideas or technological processes to help our service providers, our clients, and our partners to be able to interact with us and give them some convenience. But today, we'll be touching on what we call the e-health service and how the e-health service is giving people access to quality health care. Now, because we are all guided by the SDGs, we've realized that the SDG Goal 3 is targeted at achieving good health and well-being globally, and also targeted at reducing maternal mortality, as well as expanding the reach of universal health care. Our focus is on the expansion of universal health care. And so what we have done is introduce something we call the Glico eHealth app, or the eHealth service. Now, this service in 2021 won us the award as a Product Innovation Awards during the Ghana Insurance Awards. Now, what we have done is to give access, grant access for people to be able to communicate to health professionals at the comfort of their homes, on their farms, if they are farmers, in their offices, on the golf course, wherever they find themselves, they can have good access to quality health care. Now, I'll take you through a pictorial view of how the e-health process looks like. Now, the first gentleman in the picture, an enrollee, wonderfully sitting in his bed or in his chair, calls the call center because he's not feeling too well. The whole idea is to reduce a number of things. One major is self-medication. So he calls the call center in real time and is connected to a doctor. In his case, it's just medication. So the doctor used another platform we call the mobile pharmacy to send him medicines through our courier or our dispatch. And that service is free of charge. Now, the person is not left hanging in that process. What we do is to also re-engage the person to make sure that the person is fully recovered, so we can digitally discharge the person from our system. If we don't do that, the system will still hold them as not feeling well. So the process goes round again to make sure that they are out and discharged fully. Now, what are the key benefits of this service? Now, it gives access to virtual experienced doctors and practitioners that we have at our end. The beauty is that these doctors most of them are bilingual, and so regardless of the language you speak, from Hausa to Ewe to Ga to Chi to Dangbani, you are sure that these diverse professionals would attend to you and consult for you. Now, our patrons also get to have discount on some selected services, like laboratory service. So when they consult for you virtually, and then there's a need for you to run some labs to give the doctor some further understanding of what's wrong with you, we have partnership with some medical services, laboratory services that can come to your location, take your samples, run the labs, and then send the results to the doctor. And you can get that at a discounted service. We also have the mobile pharmacy, as I mentioned, that seeks to send you the medicine, so you don't need to go to the pharmacy to get the medicine or go to the hospital. After they consult for you, there is also a platform or a medium where the medicines are also delivered to you. To give you convenience, what we have done is to develop the app, the eHealth app, that you can download from the Google Play Store or the App Store. I know Chairman just checked up on the App Store, and so yes, you can do that. When you do Glico eHealth, it will pop up, and then you download and then follow. It's a very simple process. You follow, and then you are in there. Now, what problems have we identified over the period with what we have done since 2020? Now, the Glico eHealth app or the service have encountered a few challenges. One of them is our clients. Let's look at the problems first before we look at the challenges. Now, the problems we have tried to solve is to give the clients convenient health solutions. So now you don't need to rush to the hospital, form long queues, meet doctors for everyday conditions. You can just pick a phone and call, and then you can be sure that you are sorted out. Now, what we have also done is to help save us from self-medication. We have realized that 80 to 90% of the conditions that we are experiencing now, the kidney issues, the liver issues, the cardio issues, are as a result of self-medication. Akwesi, mitia meya, unto para ni biko ewe chiro hombreme. Literally means that Akwesi, I'm not feeling too well. Can you get me para and biko? Because we have had somebody take the same medications. And so we are trying to save or stop us from doing self-medication. We're also trying to address the universal health issues, the SDGs, make sure that we play keenly in that role to help us all sustain the health of our people. What challenges are we facing? Now, there's a growing confidence in virtual health service. We are used to, I want to see the doctor, physical consultations. And so it's becoming quite difficult for some people to actually believe that I could get the same quality of healthcare from the phone or virtually from a doctor who I can't see physically. And so there's a little challenge there. Even as much as we are trying to educate and push, yes, there's quite a few. There's also some network issues, connectivity issues in the rural areas. And so we are mindful of all the effort and energy NC is putting in there, but there are quite a few of them out there. There's also limited partnership in the rural areas for the delivery of drugs and also for the lab services. And so it affects us in the rural areas. Yes, there are efforts to expand that scope, but we are still on it. One of the gentle ones we have also identified over the period is high internet tariffs. And so people are not comfortable going online to do that. And so it's been some challenges for us. But how do we recommend? We are recommending that we intensify our public education on the e-health service. Platforms and podiums like this give us the opportunity to talk to the mass market and let them know that, yes, there's an opportunity for you to speak to doctors, speak to qualified practitioners, and have your issues sorted out without going to the hospital. So NCA, thanks so much for the opportunity. We believe this will go out there. We're also praying that there's some reduce or reduction in the cost of telecommunication tariffs to encourage people to access a lot of these goods and services on their phones or on their tablets. Expand e-health partnership as we are doing to expand the partnership to the rural and urban areas to make sure that, yes, people can get these services, especially the mobile pharmacy as well as the mobile laboratory services. We're also pushing for increased investment in the telecommunication infrastructure space to make sure that those in the rural and urban areas can get access to these things quickly. Now, before I take the questions, there's a small video I want to play that's like 2 minutes. I believe I'm still in time, within time. So just play the video for us quickly, then I can take the questions. Thank you.
Kojo, you are going to the hospital today. If not, you're going to keep getting worse.
Yes, Doc.
How many times am I supposed to tell you to go to the hospital?
3 times a day?
Really? Continue to mock me. I will drag you there myself.
Oh, babe, I'm here with the doctor.
Hey. Sorry, Doc.
So you see, this is Dr. Mensah.
Hi.
And we are having a consultation now. He was assigned to me through the Glico Health app.
Glico Health app?
Yes! The Glico Health app is basically a hospital in your pocket. You get access to doctors, discounted laboratory and pharmacy services right on your phone.
Wow, that's convenient. Wait, so I get to talk to a doctor from home?
Yes!
The office? My car? Even from the salon?
From anywhere you are. Simply download the Glico Health app from Google Play Store or App Store to get started. Okay, let me show Fico.
I know, right?
On that note, Yen fake. I'll take the question.
So, just so you know, there's an invoice waiting for you at the exit. We didn't plan that you show a commercial here, but you've done it. It's just about, Mr. Nati, how much will you charge him?
This family and friends.
Please. Any questions for Nathaniel? Yes.
Okay, thank you.
Welcome.
So I'm James, a biomedical engineering student at University of Ghana.
Okay, James.
So I want to ask about patient data. So how sure are you that when a patient enters their data onto your platform, their data is secure, and then their data will not leak to places that they are not supposed to go? And then another thing is about emergency. So if a patient is an emergency situation, how do you ensure that the patient gets to maybe the hospital on time so that the person does not waste time online? Meanwhile, they're supposed to get to the hospital. So how do you tackle these?
Okay, great. So, as a company, we are guided by the Data Protection Act, which we abide by highly. We make sure that we don't breach that Data Protection Act. At Glico Healthcare, we do not have officers managing medical documents, and so for everything medical is handled by the medical team. So the call gets to the call center, it goes straight to the medical team. So those data, even Nathaniel as head of sales, do not have those informations. It sits with the medical team. And the medical team does not divulge those informations to a third party as our SLAs guide us not to do. So you can be sure that not average officers, without any disrespect to national service people, not everyday officers get to work on those things. They are managed by medical doctors in-house. At Glico, we have 3 doctors currently sitting in-house. We have nurses sitting in-house that manage that process for us. So you can be sure that your information will not go out. The second question was? Emergency, yes. So when you call the experience center, we have 2 options. The option number 1 is you want to go by the app. So when you go by the app, it's real time. When you book, doctor gets back to you. If it's an emergency, doctor will redirect you or re-advise you to seek medical care or let somebody move you to the, because if it's an emergency, he has little or no action to do for you. If it's not through the app and it's the experience center, when you call the experience center, the team that handles the e-health service are also trained to understand the primary conditions that they can assess or they can manage within the center, even before they reroute. And so if it's an emergency, they would advise you, and then the doctors will also get back to you to advise you. If you are a client and you need an ambulance service, an emergency where you need an ambulance service, you can be sure that with the Glico card, those benefits will also be given to you freely of charge, yes.
All right, thank you. One more question?
Yes.
Okay, at the back. Oh, yeah, please, go ahead.
All right. I'm Samuel, offering medical laboratory science from ATU. My question is regarding the lab test. Let's assume the person is far away and orders for the test. How sure are we that by the time you get there or by the time the test is conducted and sent to the lab to perform, it won't waste time or the lab results won't be affected by the factors such as environment and other conditions?
Great, thank you. I guess where the question is coming from, the medical people. So yes, now the partnership on the mobile laboratory service is highly limited to the confines of Greater Accra. Normally when I say Greater Accra, I'm careful to say after Kaswa is not part. After 25 is not part, after Ebri is not part, and so we are highly confined in the confines of the proper Greater Accra. The reason is that we are selling a service, but that service is performed by a third party, which is our service provider. Now, their reach, the further they can go is how far we can go. And so currently, it is only in Accra. One of the things we mentioned was access to, expanding the access to other areas. And so that's some of the challenges we have. Now, the mobile vans are well equipped. And so when they get to your end, they perform quite all the basic ones, unless, of course, it's extreme that they need to get to the centers. But they are equipped to provide all the basic ones and results transmitted to the doctors to advise you on. So you can be sure that there will not be any contamination. It's not motorbikes or couriers picking up a sample and sending to the lab. No, the labs are well equipped, and we are doing that with a lot of partners that are helping us to do that. We are praying that we'll go to the Greater Kumasi, Cape Coast, and the others very soon.
Thank you.
Thank you.
All right, thank you very much, Nathaniel Kofi, Head of Sales at Glico.